Hi, I'm Sean Young. I'm an assistant professor of family medicine at UCLA and at the Center for Behavioral and Addiction Medicine. And I work on designing and evaluating ways to use mobile health technologies for health behavior change and patient engagement. And that's what we're going to talk about in this video. People are complicated in changing their behavior. We need to have a good understanding of human psychology and the factors that might stop someone from engaging in certain health behaviors. Rather than taking a broad overview of all those factors, we're going to talk about one of those factors, stigma, and how stigma prevents people from engaging in positive health behaviors, and how we can use social mobile technologies to overcome stigma and improve global health.
Stigma is the disapproval of a person or group for being different than what is commonly accepted in our society. There are multiple types of stigma, and they affect health behaviors in different ways, but we're going to talk about what's called potential stigma. This is potential stigma, and here's an example of potential stigma. Let's take Jill. This is stick figure Jill, and Jill is dating another stick figure. Let's call him Bill, and they're dating, so we'll have a nice heart since they're dating. Jill and Bill. And Jill knows, hopefully they both know, that they should get an HIV test to know their HIV status before having sex. However, HIV is stigmatized, meaning that people don't want to be HIV positive, not just because of the health issue, but also because people make judgments that those who are HIV positive are immoral and sexually promiscuous. So even just testing for HIV is stigmatized, because by testing, Jill would be admitting that she might be HIV positive, and therefore the type of person who is immoral and promiscuous. If people test and learn they're HIV positive at an early stage, they can get medication and live a healthy life. But Jill doesn't get an HIV test because of her fear of the potential stigma associated with testing for HIV. So, how do we help Jill and others who are at risk get an HIV test? In order to change Jill's health behavior and get her to get tested, it's important to reduce her fears about the potential stigma associated with HIV testing. But first, do we really know that potential stigma is what's causing Jill to not get tested? And second, how can we use mobile technologies to reduce this stigma, and would reducing it make her more likely to get tested? To address the first question, researchers at Stanford University Department of Psychology looked at whether stigma reduced people's willingness to get an HIV test. They went around to college dormitories and carried fake pamphlets from the Stanford Health Clinic that described a disease that was going on around campus, except the students didn't know that the information was fake until the end of the study. The pamphlets told students how the disease could be contracted and asked them whether they thought they were infected. And the disease was called Staphylococcus cephalinus or cephalinus. I guess it really doesn't matter since it was a fake disease anyway. But the students saw, half of them saw information that said it was caused from non-stigmatized methods, such as exposure to crowded settings and prolonged exposure to infected individuals. And the other half saw those same non-stigmatized ways, but also saw that it could be caused by unprotected sex or exchange of bodily fluids. And adding this extra method now made it an STD and made it stigmatized. So, which group was more likely to say they might have the disease? Well, even though adding unprotected sex is an additional way that the students could have been infected, meaning they should be more likely to have been infected than this other group, students in the STD group said they were about half as likely to have contracted the disease. This showed that potential stigma, or fear of being stigmatized affects people's health-related thoughts and behaviors and makes them reluctant to admit that they might be at risk for a disease like HIV and wouldn't want to get an HIV test. So how can we use mobile technologies in order to reduce stigma, and will reducing it change people's health behaviors? So in this case, will it make them more likely to test for HIV? Well, our team in family medicine has used social networking technologies. For some of the studies, we've used Facebook to try and reduce HIV-related stigma and target groups who are at the highest risk for HIV to help them to get tested and know their status. Social networks are great for health behavior change because they allow us to quickly connect to a large group of people, and because they're used all over the world and therefore can be used to improve global health. Well, in order to reduce HIV stigma, we recruited peer leaders, and these are peer leaders were people who are well respected in their community, well liked by others, and we trained them in HIV prevention and how to use social media to communicate HIV prevention information to people at risk. And then we recruited participants. This is participant 1, participant 2. We recruited a bunch of participants and had them join closed Facebook groups. So they join these groups with the peer leader. These are closed groups. And the peer leaders would talk to them about HIV risk and HIV testing in order to encourage them to get tested. And as these well-respected leaders began talking about HIV on the Facebook group, it made it easier for group members to also talk to each other about getting tested and to help reduce their fears of getting tested. And as a result of talking about it, this helped to reduce HIV stigma and making it more normal to talk about getting tested for HIV. So with this approach, we found that people who are in these groups were much more likely to have gotten an HIV test compared to people who are not in these groups. And because people use social networks all over the world, we found that these results were true in California, and we've also tried it in Peru in South America. So this has been just one example of how social mobile technologies can be used to change health behaviors globally. And keep in mind that to change health behaviors, we learned that first, we need to understand the psychological barriers that were stopping people from changing their behavior and getting an HIV test. In this case, it was potential stigma. And second, that the social networking group I described was just one solution, but typically we pair up multiple solutions to make it more effective and to help maintain behavior change. And behavior change maintenance is another big issue and something we can talk about at another time.